because we might be moving to more of a technology-driven environment, the trust factor should not go down. There's an argument that says it should go up. And we're talking about schedule. I mean, think about technology within actual patient care, right? You trust the technology. It's well built. We've got data at a scale now where it's well tested. And so I think it's interesting. I think trust is going to go up in our healthcare system over the next few decades. And that's going to be driven by technology.
Choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered health. We highlight innovators who are bridging the gap between sick care and well care, influencing change in the industry, and empowering consumers with cool new ways to engage in their health and wellness. We're also having some fun along the way. I'm Jared Johnson, and this is episode 466. Today we have the Flava of the week about Best Buy's senior care products. Why is their new digital shopping experience a good reminder to focus on products that don't typically get a lot of fanfare? And how can we each play a bigger role in accelerating the adoption of consumer health? I'll talk about that. Then Matt Blosl joins us to share some of his observations from his first few months as CEO of DexCare, how the concept of care orchestration helps health systems see care journeys from the consumer's point of view, and the tsunami of innovation that's already washing ashore. It's time for the awesomeness, y'all. Are you ready? Let's go.
Flava of the week.
Best Buy Health released an updated digital shopping experience, which means it's a good time to circle back on their latest offerings for home health, specifically their Lively brand of health and safety products for seniors. Here's a quick recap of their offerings. Lively offers a line of simple cell phones, including the Jitterbug and Lively Smart, that are designed for ease of use with large screens and buttons. They also provide dedicated medical alert devices like the Lively Mobile 2, which can be worn as a pendant or wrist wearable. And they offer related services, including Urgent Response, which is a 24/7 emergency service where users can connect to a highly trained agent for help in any situation by pressing a button. Their Nurse on Call, which is 24/7 access to nurses and doctors for medical advice. Lively Link, a smartphone app that allows friends and family to track the user's location, be notified in case of an emergency, and stay informed about their health and safety. Care Advocate, a service that provides personalized plans to improve health and wellness. And Fall Detection, an optional feature for certain devices that automatically calls for help if a fall is detected. Their stated goal with all of these products and services is to help older adults stay active and independent by providing simple, reliable technology and human-supported health and safety solutions. Now, I find it interesting that I've heard little fanfare for Best Buy's senior health products and services, but they appear to be a bright spot for the retailer amidst a year of restructuring. In their May earnings report, in which they announced the divestiture of Current Health and noted financial struggles among the company's health system partners like Advocate and Mass General Brigham, they pointed out that their active aging and Lively verticals were quote-unquote still viable, which is another way of saying their senior care lines might just save their health business. What's the consumer lens? The unique thing about consumer health is that it's on an individual basis. So whether or not the Lively product line ends up being a solution for Best Buy's healthcare vertical moving forward, if one of their devices is what keeps your aging parent healthy and safe, that's all that matters. Health will always be highly personal. So maybe if we remember that a little more often as we design, build, and market healthcare services, we'll see that adoption curve really accelerate. Let's remember product lines like Lively so we can each play a bigger role in accelerating the adoption of consumer health. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
Healthcare Wrap is sponsored by Cyril. Whether you're trying to drive patient volume as a healthcare provider, boost membership enrollment as a health insurer, drive improved adherence rates in pharma, or deepen strategic B2B partnerships throughout the healthcare ecosystem, Cyril can help you with your go-to-market efforts and growth targets, enabling you to reach the clinical and financial goals of your healthcare organization. For more information, go to Cyril.com. That's CYRALL.com.
flow.
All right, let's get into the flow. Zane, welcome back. How have things been?
Hey, Jared. Good, not bad. Settling into fall up here in Detroit, which is starting to get cool. I'm guessing it's still pretty hot down in Arizona.
Safe to say. Yeah, most of the year. So for sure.
Yes.
Zane, we're going to be speaking with Matt from DexCare, and just wondered what you were hoping to get out of this interview today.
Oh man, so many thoughts. Well, I guess I would say if I put my day job hat on, health systems around the country, even though they're thinking about AI and all this cool, sexy, exciting things that have been coming in the news the last few months, core digital front door capabilities are still a big opportunity. Care orchestration, all that stuff that maybe 3 or 4 years ago was the buzzwords of the day. Still a ton of opportunity for hospital systems to improve there. And I know DexCare plays directly in that space. So excited to hear about what they're up to, what they're doing with their customers, what might be new. Maybe they're thinking about things a little bit different. But I think this episode is going to be one of those core episodes that everyone needs to listen to and get right. And I hope they do.
I love it. All right, let's welcome Matt. Matt Blosl, the CEO of DexCare. Welcome to the Healthcare Wrap.
Thank you. Excited to be here.
You've been at DexCare for a few months. What are some of those first observations? That'll probably help us get to know you a little bit better.
Yeah, I've been here about 6 months now. And as most people probably say, it definitely feels like much longer than that. Listen, there's a lot to observe, both within the company and the market and our customers. I'd say the biggest thing that I'm talking to people about is that for DexCare, we went through a period of hyper growth. When you are part of a high growth company, you reach these inflection points, right? Where you need to kind of take stock, think about what it's going to take to get to the next level. And so at DexCare, when I joined, we were in this natural position based on the maturation of our business to kind of think about what the next two to 3 years are look like, because things have changed. And the observation that really stands out to me is that we're all doing that. Right? I mean, within healthcare, certainly. When you think about it, the healthcare industry, right? Whether it's the macroeconomic conditions that we're all facing, whether it's potential policy changes, the health systems are rethinking their business. You've got all of the technology providers, large and small, that are rethinking their business because there's this new thing called AI that has dramatically disrupted the landscape. And so it's one of those things where I actually feel very fortunate to be kind of going through the next level of a growth acceleration at DexCare, because everyone's rethinking their business. And so it's a great opportunity for us to capitalize on all the progress we made, the great clients we have, and really be part of what the next horizon of healthcare is going to look like.
Love that. Could you just, for our listeners who are hearing about you for the first time, could you briefly explain what DexCare does, some of your key services, and how they interact with health systems?
It's quite simple at DexCare. When we started the company, we were very focused on how do we get patients easier access to healthcare, right? And so there's kind of two sides to that. One is how do we just make the whole discovery process and the entry point to healthcare easier for patients. And then there's the other half of it, which is there's a lot of complexity within health systems, and getting the right provider to the right patient is very difficult. And so we work kind of on the other side of that transaction with our health systems to navigate all of the data, policies, and complexity to make sure that we are really getting the right patient to the right provider, which a lot of us have that ambition, but we're really at the forefront of doing that.
Love that. What would you, I guess you sort of alluded it to there in your answer, but what would you say is keeping health systems from, call it, modernizing that journey, or, making it easy for folks to access the right physician, the right appointment, even find the right type of appointment? What would you say is holding systems back from just being able to do that?
Listen, I would say it's absolutely the data. Right?
Sure.
In the complexity of the data within health systems. And it's all there, but being able to access it, pull it all together, create insights from it, and then use those insights to trigger whatever the next action is. And that's where we are super excited, because obviously with the new technology, and not even just AI, but where technology is today, the processing of data, the aggregation of data is much easier than it ever was before. And so now we can go into health systems who historically have looked at things that are impossible, because they would say, oh, we've got to go over to this side of the business to find out this piece of information, then this side of the business to find out that. we can make that connectivity happen in real time and at scale. And so I think it's nothing new that we're entering into the system. We're just helping them navigate their natural complexity in a much easier way and unleash the power of what their underlying data can do.
I'm just laughing, and I've mentioned this to our listeners before. In my past, I used to work for Henry Ford Health System in Detroit. And I remember getting staffed to a project to get to the source of truth on sites, providers, and hours of operation. And so, Matt, we had this massive Excel spreadsheet, and it literally took 2 years and to just get to the truth, right? It would update every other hour. So there'd be some change. So I just can't imagine just how difficult it was to get that in addition to everything else that you all help collect and federate for health systems. I can see why you would want a digital solution to help with all this.
You kind of highlighted multiple variables there. I mean, any one of those variables or data points is so hard for a health system to keep up to date. I mean, take a very simple one, provider directories. Believe it or not, those still live in Excel spreadsheets or video diagrams. By the time somebody goes through and updates them, they're already out of date, right?
Yep.
And it's complexity that the systems at health systems just aren't set up and prepared to really keep in real time. And so I can't share too much of it, but we have a new product coming out, or a new capability, I should say, coming out, where we can do that all in real time. We've literally taken a large health system, inputted their entire provider directory, and kicked out optimization of it within seconds.
That's insane.
Yeah, we had a client play his card, so to speak, but said, this is incredible. This would have taken us 9 months and a team of data specialists to execute. It's crazy. And so, yeah, it really just comes back to unleashing the power of data that really just are.
Yeah, the other thing I think about is it's not just collecting all that data, keeping up to date, but even the upfront work of deciding on definitions. If you ask a health system, what provider should be in your directory? There's 5 different ways to think about, well, who's an actual provider and who should be there, whether it's within your network or your medical group, and then coming up with a service line definition, who fits within primary care versus women's health or whatever. And what a mess. For those that aren't necessarily deep in the weeds in healthcare, it's super complicated, and we can't put enough emphasis on that.
The level of personalization that it's going to enable, because in a perfect world, you'd have Snowflake patient paired with Snowflake provider, right? But the level of personalization that could take, I mean, you've mentioned just more matching them on geo, but the level of personalization that you could start to get to is really incredible. It is something that health systems couldn't even think about doing before, because they were how would we ever aggregate all that data and be able to intelligently make that match?
Welcome to the stage, AI, to help make all this work.
Right.
I'm curious, well, maybe with that in mind, then in this personalization, DexCare brands itself, positions itself as being able to help with this notion of care orchestration. Would love to know, in your mind, what does that look like? What does that mean? What does this look like to consumers? And I know we've talked through it, but would love to talk about what's the infrastructure that health systems need to do this really well?
It's a great question, because care orchestration is one of those terms that's been around for a while. It was innovative a number of years ago, but now it's got such a broad definition that it can take a number of different meanings. Quite simply for us, it's making it easy for a patient to get the right care. And what does that mean? So at DexCare, it's interesting because we're often thought of as a technology company, because that's obviously we've built pieces of technology that enable health systems to optimize care orchestration. But if you think about it, we've been doing this for a fair amount of time now. Spun out of Providence 5 years ago, obviously working on it well before then. We've developed a wealth of knowledge, best practices, and experience working with a lot of diverse health systems to where we really see ourselves as an expert or consultant in care orchestration. So rather than think of it as a piece of technology or a solution, it's about how do you go into a health system, understand what systems they have, which ones are working, which ones aren't. To our previous discussion, what is the data underlying it? And how can we string all of that together in the best possible way to make it so a patient can come, for example, to the website as easy as possible. Almost think of normal consumer retail type of experience. Input what's going on with them, what they're looking for. And then on the back end, have the health system be able to ingest that information. And again, not asking a series of 20 questions in a very simple way, then take that, what's been ingested from the patient, and then serve up the right mechanism. That could be a provider. That could be, maybe they don't need to see a provider based on what they said. We can get a virtual visit going.
Sure.
So there's a lot of different ways in which you can do it. And I think what's become powerful at DexCare is, yes, we have a platform that can allow you to do all of the things from attracting people to your website to getting them through, answering questions, and then even serving up a virtual visit. But we really view ourselves as being a little bit more of, let's start with, how do we optimize that process? Because if you think about it, this company was founded, very early on had executives from Amazon. And what did they bring to the table? They brought to the table the latest and greatest in consumer/patient behavior. And so we've used a lot of it. We've tried things that have worked. We've tried things that have not worked or just have been too much for the healthcare setting.
Yep.
And so we really come in with a consultative approach, really not biased, obviously we'd love for them to use our actual channels and products, but they don't have to. But what we can do is just ensure that we leverage the technology they have, offer them anything they don't have. So that process of coming to a health system and getting that next step access is the most applicable one based on the situation and the needs that you have.
I love the consultative approach because what I've learned in interviewing guests on the podcast and through my day job is every hospital system and institution and organization is in such a different place. And so I think if you try to show up with your standard set of tools, it's probably not going to land. And then leaders across the country just have different levels of understanding of what good looks like in this space. And so I think the educating, the handholding, the coaching, the consulting to then get them to understand and see what I think the three of us understand is probably that right approach.
That's said very well, because if you think about the technology component to any of this, it's not revolutionary. They're all, you could argue, commodity execution from a technology perspective. To me, the role we play and where we see playing for a very long time is being that consultant that can come in, understand what are the health system priorities. Some, it could be grow commercial share. They're in a very highly competitive environment. Great. There's a way to orchestrate, right, that care process with that in mind. There's others. I was just on the phone with a client where I don't want any more patients. I can't service the ones that I have today. Different way in which they need to address the care orchestration problem. So it's much more about understanding the nuances, priorities of the health system, helping them get the intelligence together so that they can execute. And then the channels and the execution of the channels. If they use DexCare is great. If they have the others, that's fine. I don't think that's the strategic place that we play.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap.
And what I'm hearing in what you just said is like true strategy has to be baked into this. It's not just, okay, yeah, go set up the directory, go set up the scheduling system, but like you really have to think about in a nuanced way, what are we hoping that this funnel, if you will, is going to achieve for the business needs of the organization? And I don't think a lot of digital health leaders actually always think that way. I think they're focused on, okay, let me stand up the tech, let me check the box and make sure I have my digital front door ready to go, but not in a nuanced way to think about how do we configure it to achieve the overall strategic objectives of the organization or institution. And so love what you just said.
Yeah, that's right. That's why one of the things I always say to my commercial team is we're not selling anything to one individual, right? Like you often ask, who's your ideal customer? To your point, it's not just the marketing department, for example, to optimize the digital front door. When you talk about care orchestration, you're pulling together the marketing side of the business, the technology side of the business, the clinical side of the business, right? And so you're absolutely right. And that's why you view it more as a consultative approach.
Yeah, and sometimes those camps don't actually ever talk.
Yeah.
And so you might be the first one to bring them together.
That's right. Sometimes we serve in the peacekeeping role as well.
That's really what's being orchestrated here. And I'll double down on what Zane was just saying about health system leaders, by and large, aren't necessarily fully thinking this way yet. And if we think about it as like, what's the consumer point of view here? That's the thing we try to point out often on this show. From the consumer's point of view, like what's being orchestrated, I don't think they think about it that way. I think they think, yeah, it should be user-friendly to search and book care, like period. That's the basis, instead of saying, hey, well, here's what we've been able to do historically. Like the traditional health system leadership thought process, which isn't making excuses. Like it's very real, the limitations and the challenges that are there. What we've found, I'll speak for Zane too. I think what we've both found is when you inject more of the consumer point of view, it changes the conversation and it does make it more possible. It kind of opens up people to be like, we're not there yet. Like there are more things we need to do here. So in this case, we're talking about care orchestration. Are we talking about search and booking care? Just to like get a little more technical here, like what are the components that are being orchestrated?
It's interesting. I think it's a number of things. But before I go into the kind of specifics of that question, I think what's interesting is two things. One, for the most part, patients, and this is unfortunate, they don't have high expectations when they go to, even in a digital environment, to interact with their healthcare system, if you will, right? We've been so behind, if you will, for so long that the expectations are pretty low. That being said, I think that really provides an incredible opportunity for us to leap forward, because imagine if we could create an experience where it's as easy as changing my plan with Verizon for my cell phone, or going and booking a complete vacation for my family. It doesn't have to be that difficult, but it comes back to, what we were talking about is the back end is so complex and there's so many different components to it. It makes it really hard to deliver that simple front end experience. Now, I do think the world we live in from a technology perspective provides it. We're still learning it, but it provides the opportunity to do it. So there's a lot of work that needs to be done there. You kind of have a collision of a lot of different elements that are coming together, powered by kind of modern technology, if you will, that I think can really unlock the ability for healthcare to take a leap forward, right? You don't have to talk to somebody at the front desk. You don't have to answer 20 questions just to really, and no matter how you answer those 20, you end up at the same spot, right?
20 questions, especially 20 questions to then get asked the same 20 questions when you show up, right?
That exists. And then less visible to, not really visible at all to the patient is there's as much complexity on the back end, right? I mean, we talked about providers and the different decision trees and what days of the week do they work? What types of care do they prefer? We also have to build that trust and confidence within the provider network so that they are willing to let technology book their appointments, right? We always think about it just as the patient side. The provider side is just as important, more complex. And that's an area where I believe health systems have a lot of work to do, right? Which is to get the healthcare providers comfortable with technology doing exactly what their front desk representative would do for them.
I think too, as you're speaking, some people might listen say, wow, this feels icky, like we're trying to use technology to basically bring more business into the health system. But I would almost reframe it as, no, we're trying to personalize the journey. And thinking about targeting people who actually have the need and being able to pull them in. And it's almost like from an equity and inclusion, like we're pulling people into the system so they can get what they need, which I appreciate.
I think it's a really important point because DexCare started very much in kind of that, how do we get more patients to the health system? That is very little of what we talk about today, right? This is not about just growing share within your health system. The one thing that we all know, our entire lives, we've heard about how the United States healthcare system is inefficient, right? And how that's why costs are the way they are. I see what DexCare does, and we're not the only ones. There's a whole set of technology providers that we're really just trying to make the health systems more efficient, right? And there's a lot of room to go. And there's market conditions. And I always like to say the EMRs, Epic, Cerner, Meditech, whatever EHR you're on, I think that's a market condition, right? It's the central nervous system of the hospitals. They're only going to be able to do so much, right? They're only going to be able to and want to do so much. And in my mind, the DexCares of the world exist to continue to leverage, obviously, that central nervous system. But how can we take it and make it even more efficient, make it even more personalized for the patient, make it more, what's the right word? Probably more accurate for the provider so that they know they have confidence when they go into their schedule for the day. These are all patients that I'm supposed to be seeing.
This might be a bit of it wasn't a specific question on the list, but I'm going to ask it. So I've been listening to this Everything You Need to Know AI podcast every morning. It's 20 minutes, gives you what you need to know for the day. I'm hearing a lot of discussion now around agentic AI, things like agentic e-commerce. So basically this idea that as agentic search tools become more popular, agents will be going out there and completing transactions on behalf of consumers and eventually patients. So I'm curious if you have any perspective on, with agentic AI and agentic search being on the cusp here, what do health systems need to do? And is there a play for DexCare to help get them ready for that?
There's a lot of players already out there. There's a lot of health systems that are already maybe not full adoption, but are testing it. It's one of those areas where, let's just use the call center as an example I used previously. Those are massive organizations, massive cost centers for health systems. They aren't the most efficient. Patients also don't always love the experience because they may have to wait or they get transferred. And so that's a use case where I think agentic solutions has a real role because it's an area where patients can have a better experience. And at the same time, it can drive a lot of efficiency within the health system. Does that mean the call center will go away? Of course not. But it's one of those where you might be able to apply the 80-20 rule and say 80% of these calls we can get done quicker, better in a fraction of the time. And then the 20% where it needs to be more of an in-depth conversation that it would take a long time to get an agentic model prepared for, those will always exist. But agentic solutions is, I would say that's probably the most predominant thing that we hear our healthcare partners talking about today. The technology has actually been available for some time within healthcare, just like other industries. There's a level of data and privacy that we need to consider that I think does cause it to be slower for adoption than in other verticals. But to me, there's nothing preventative there. You're going to see more and more health systems adopting those. I use the call center as an example. There's a lot of other places.
I need an agent to make all my PowerPoints and Excel spreadsheets.
That's at the top of my list. That's a weakness of mine. Matt, I think we could keep talking all day on this. What's your advice to those consumers, the ones who are doing this all for, who are struggling to navigate their healthcare journeys? So if you're sitting here using this as a platform to talk directly to somebody who feels like they're struggling, they need or want care, they don't know how to get it, it's frustrating to them, what's your advice to them?
It's interesting. Two things kind of come to mind when you ask that question. First is a little bit of probably a plea for patience, because I really do believe more than any other time in the 20 years that I've been involved in healthcare, there really is a tsunami of innovation that is quickly going to be embedded into our healthcare system. It's unavoidable. It's a level of, I don't even want to call it disruption. It's a level of capability advancement that we just haven't seen, right? I mean, we can go back and talk about the other periods. And listen, health systems, they're doing a good job now. I do think the pace at which you'll see advancement and let's just call it ease of accessing care, it's coming, and it's coming very quickly. So that's one, is that whether it's patience or give them hope, because there's not a health system that we talk to or a prospective client or an existing client that is not actively thinking about this. People that sit in these positions, whether it's a chief digital officer, chief transformation officer, they all have them at this point, and they are starting to make really significant investments in that realm. The other thing, though, that I think is really important for any of us that work kind of in the healthcare technology space is to remind them that because we might be moving to more of a technology-driven environment, the trust factor should not go down. There's an argument that says it should go up, right? Because I think that's the one thing is that people don't trust the healthcare system. And I think when you start to innovate, that can make people, if they already don't have a high degree of trust or confidence, it can make them kind of step back a little bit. And what I would encourage everybody is to really think about that in reverse, because the advancement in technology is actually going to make our health system stronger, better data, better decisions. And so that's something that I know the healthcare community is talking about, is how do we get people comfortable with the advancements in technology? And we're talking about scheduling. I mean, think about technology within actual patient care, right? You trust the technology. It's well built. We've got data at a scale now where it's well tested. And so I think it's interesting. I think trust is going to go up in our healthcare system over the next few decades. And that's going to be driven by technology, which I think a lot of times at first blush, people tend to lean towards, well, should I trust it? So that would be the other thing. So I would say optimism and trust would be the two things.
Love that.
Perfect place for us to wrap too. That's a wrap for this episode. Matt, we'd love to have you back on. We need to do a part 2. We need to dig in even more and dive into some of these problems that are being solved and the ways that we're doing that and what we can learn. So we'll figure that out. But in the meantime, just want to thank you for everything you're doing to make healthcare consumer first on behalf of patients out there. Thanks for joining us today.
Thank you. It's a great conversation. Love your show.